Hello, it's Dr. Shelley, and I have some freebies for you if you're in nursing school. Are you in nursing school? Because this is very serious. I want you to succeed in nursing school, but first, you gotta hit that subscribe button so that you can get all the freebies that I have to give you. I'm feeling generous. What do you want? It's 2023. Now listen. With nursing school, would you agree that you pay all that money and some of these programs, if not most of these programs, make you teach yourself? And then if you were screwed during the pandemic, you didn't even get clinicals. Well, I have some hope for you. I have some good news about your nursing program and you succeeding in nursing school. It's as simple as use everything around you. Now, I don't know if you know, but while you're trying to get into nursing school, or if you're already in nursing school, you don't even have to be a nursing assistant, and the Cleveland Clinic will train you in a way that you can learn even more on site at the hospital, where you're immersed in clinical situations all day long. So first off, if you need a job or if you want a different job, try going to the Cleveland Clinic. Tell them Shelley Tufts Bevel, Dr. Shelley sent you. Again, that's just one thing. Get in the field so you get excited and you learn about it. Number two, if you're in nursing school and you want to succeed, then you're gonna just have to bite the bullet and make sure that you get some extra NCLEX type questions, because the NCLEX type questions, even though that's a test you take after you get out of nursing school, those are the same questions your teachers are gonna use anyway. So you just need to get some type of software. Now, if you need any tips, I'll be back later with that and evaluate some of the different software you can buy online to help you through nursing school. The second thing is, it's not enough to just buy the software. No, you have to review the rationales on every question that you do. You review the rationale, you take notes off the rationale, and you organize all those questions. But some people like to do a lot of questions at the same time. No, that's not going to help you succeed. Nobody got time for that. I'm trying to just get you started. You need to look at the questions that you do, whether it's in a review book or it's software, which I prefer software. The more you can get your hands all dirty with the technology, the better. So if you're going to go ahead and use the software, it's way better than a review book. But the software, let's get back to that. When you get this software, you only want to do 5 to 25 questions at a time, because it's a lot of content, and you can't do 75 and think you're going to go back and review the rationale in all of a couple hours time. No, you don't have time for that. So you really want to do NCLEX type questions. You want to make sure that you only do 5 to 25 at a time. You want to structure yourself so that you do one subject at a time. And then I got some fun stuff for you to do, just all part of the gig. You want to look at every television commercial you see. If there's a medication on a television commercial, pay attention to it, stop the television, look at the med, write it down, organize it. Girl, if you know like I know, you get your life together when it comes to those television commercials. Now, some more tips. My favorite show for nursing students to watch, and they enjoy it, and it doesn't cost much, is Grey's Anatomy. Let's take a look at Grey's Anatomy as it applies to you in nursing school. Everybody knows that this new generation, or this next generation NCLEX exam, is going to have case studies. So you might as well start now trying to think in terms of case studies. So if you do what I tell you and you go to Netflix and then you turn on Grey's Anatomy and you look at season 1, episode 1, look what I got for you. Season 1, episode 1, if you come all the way up here, and sometimes you got to raise the phone to get it all the way up there, but if you come all the way up here, you'll see that I actually summarized the patient in Grey's Anatomy. Let's have fun. 15-year-old with new onset intermittent seizures during the past week. Patient is having grand mal seizures. IV was lost on arrival. I could do so much with that. For example, I know for a fact that you've got to know what gauge IV a 16-year-old would have to have in their arm. 15-year-old, my bad. You would have to know it's an 18 gauge, because an 18 gauge needle is for all adults. You'd also have to know that grand looks like the word big, or it seems like it would mean that. Mal is French for bad. Big, bad seizures. Now, you know daggone well that's a medical emergency. So as you're looking at Grey's Anatomy and you're watching her have these huge seizures and they just started, you may remember that I taught you that anything that says new onset, sudden, all of a sudden, is a prioritizing patient. In other words, see them first. Now, I got to come back and talk to you about delegation, prioritization, ethical, legal. I'll be back, y'all. I got to go. You saw my coat. I ain't got time. Bye, deuces.